of the Select Board of Westford. I would like to call to order this meeting for Tuesday, March 17th, 2020 at 7 p.m. We are meeting via video conference this evening, and I have a few comments before we get started with our agenda. First of all, this meeting is because of an unprecedented event in our lifetimes, and we are meeting tonight to address these urgent concerns. This is our first remote select board meeting. If you'd like to be able to pose a question or speak, we ask you to follow the link in our agenda that is posted on the town's website. If your question isn't answered tonight, you can also call or email the town manager's office tomorrow, and we'll get back to you. Before we begin, I'd like to ask first that you mute your audio when you're not speaking. Use your headphones if you can, and you will need to turn on your video, and then we can control the video if you are one of the panelists. If you're an attendee calling in, then there's no video capability for you. This is an open meeting, so for the panelists who have access to the chat panel, I would like to remind you to not discuss anything with the content of the meeting, but to use the chat only if you're asking a question or to address technical questions about the video conferencing this evening. For the public, I'd like to let you know that tonight we have all 5 of our select board members here with us this evening. We also have our town manager, Jody Ross. We have I believe we have the chair of the Board of Health with us or joining us, Zach Cataldo. We also have the director of the Health Department, Jeff Stevens. Our town moderator, Susan Spooler, is with us. IT director, Mike Wells, is helping run the meeting. And we are also streaming on Westford Cat and recording this meeting. And we also have numerous members of the public who have been able to dial in and join us as well.
Elizabeth, I'm sorry to interrupt. It's Sue Hanley. Zach Cataldo and Michelle Crawford cannot get in. I got a text from them. If Mike could resend the link, they are both not able to get in.
Okay. Mike, can you work on that while we proceed? So I'd like to start by saying that we're relying on information that's been given to us from the President of the United States, the Centers for Disease Control, and the Governor of Massachusetts. And we'll be using that information to guide the decisions that we're making tonight. The Centers for Disease Control has recommended gatherings of no more than 50 people for the next 8 weeks. Our governor has asked for gatherings of no more than 25 people for the next 3 weeks. What we are discussing here this evening is our town's efforts to support social distancing in order to minimize the spread of COVID-19. The measures we are discussing tonight will be balanced with the fact that we need to maintain essential town services during this time, including public safety, as well as clean water and safe roads. We also want to keep up routine town services, such as issuing licenses and permits, to the extent that it is safe to do so. I want to say thank you to Jody Ross, our town manager, and all of the town staff. Jody, we appreciate your leadership over the past week in recognizing the seriousness of the situation and working with our staff to continue town services, while also making it possible for us to continue our tradition of transparent government with open meetings. This meeting will be the first of a frequent series of meetings. We have a select board meeting scheduled for next Tuesday, March 24th. We will meet as frequently as necessary to make decisive actions to protect the health and well-being of our residents and staff. This is our first remote select board meeting. I ask for and appreciate your patience as I chair this meeting with all of our members participating remotely. And select board members, I can see you, so if you'd like to make a comment, just wave your hand. Other members who are participating, I believe there's a wave your hand option in the control panel. And at a certain point in the meeting, we will open it up for questions. I think folks who call in may be able to ask questions at that time. So we'll do the best we can to hear from everyone that would like to speak tonight. And if we can't answer your questions, we'll be sure to follow up tomorrow or next week. So with that, I would like to turn it over to, or first I'll open it up for any announcements from the members of the board. All right, seeing none. Jody, would you like to take over with the things you've organized for us this evening?
Sure. I got to pull up the document. Excuse me 1 second. Sorry, I didn't know I was on first. Hold on. Hold on. Sorry. Trying to get to my desktop.
Yes, Scott?
In the meantime, one thing where
Thank you.
if you've been in a grocery store recently, you realize there's nothing on the shelves. So think about the town's food pantry, that they are operating themselves under reduced interaction. So, but I would suggest if you call ahead, because they will answer the phone, see what they need and see what the process is to drop off food. Because if we're all stockpiling, think what it feels like to be somebody who can't afford to stockpile, worried about what's going on out there. So just thought I would mention that tonight.
Thank you, Scott.
Okay, sorry about that. I didn't know I was on first. So first of all, I just like to take a second to thank the department heads and the town staff. We closed at noon on Friday, as you know. Many of us worked all weekend nonstop pretty much to make this happen right now and other things, but everybody is doing what they need to do to continue town services. And I think we're doing pretty well. We're learning some things, and but I think we're all working together and doing pretty well. So a couple things you're going to talk about tonight, and I know that's whether you delay the town meeting and that sort of thing, but if you'd like me to get into the specifics of what the impact is on the residents, I'm happy to go through a few of those specifics tonight.
Yes, I think if you want to start with that, with the impacts on residents, and then we can move into the decisions that we need to make in terms of town meeting or elections or any other timely issues. And even if we can't make the decision tonight, we can get it on the table and then revisit the topics next week.
Okay. Well, first of all, I want to reiterate we're here to serve the public. And honestly, I think we're doing a fairly good job of that. But I'm going to go department by department and just outline a couple of the impacts on the residents. There's a lot of impacts internally, but this is just for the residents. So starting with the health department, I think that we have set off, we have scheduled times with developers and so on to drop off their permit applications outside of the town hall. We're working on that, but we are encouraging all applications be emailed in electronically. I'm hearing some background from people. I don't know if somebody can mute themselves. Also, nursing will be handled on a case-by-case basis, depending on the needs of what they're facing. I'm still getting a little feedback from someone. I'm not sure who that is, but okay. Fire department, we're temporarily suspending any inside of the home inspections. New construction inspections will continue. That's, for fire, for different fire permits. We discontinued the EMT student ride-along, which is something we offer. Internships are suspended. And unless it's a walk-in medical, the public access is limited to the fire station. There's no station tours going on at this time. For the police department, they are continuing to process firearms applications, license to carry, but they're no longer accepting them in person at the police station. Any applicant must mail in their application, and then we will make arrangements to meet with them through the glass windows. We are also prohibiting any visitors inside the station except in an emergency situation. And I just think it's important to mention that we're trying to keep our first responders healthy so that they can respond to all of you. And that's the only reason, is just to make sure that they stay as healthy as possible during this situation. So when people do call 911 and ask for someone to come, a public safety person to come to their residence, we are asking if they're under self-quarantine or have tested positive for the virus, that they do notify the dispatcher. We obviously don't want to violate anyone's, privacy, but I think it's important that we know what equipment to have on when we respond to your residents, again, to keep the firefighters and police officers safe and healthy. So let's talk about our seniors. We've been trying very hard to keep our seniors serviced during this time. The Cameron Senior Center is staffed. All of our departments are staffed. Some are remote, some are in the offices. We're trying to separate that, but we are poised to carry out any essential services for our seniors and additional services as we learn about that. We are calling residents on our special population emergency list to share the additional services we're offering. We're checking in on everyone the way we always do during emergencies. We are supporting those calls with the MRC. Social services are being done only on critical home visits, so that is continuing. There is grocery shopping and prescription delivery available for seniors, and we will help you with that. You may call Allison Christopher. It's all on our website, but people listening, it's 978-399-2325, or Annette Cerullo at 978-399-2326. We are working with the housing authorities and the people that live in those facilities. Lots of other things. Meals on Wheels are still continuing. We are delivering those to outside the residence. We have medical equipment loaning. The food pantry is still operating. All of this is on the website, so we encourage you to go to westfordma.gov or call us. Our phones are all working. If we don't pick up, we're probably on another line. We're happy to call you back. So we'll continue more information in my newsletter, which is hopefully going out tomorrow, and it is on our website. A lot about financial relief too, but I won't get into that right now. Let me move on.
Actually, Jody, a quick question. I had someone ask about trash and recycling. That's continuing on normal schedule, right?
I was going to touch on that at the very end of this, but at this point, trash and recycling will continue as usual. I'm hoping that that doesn't change, but at this point, just follow the usual schedule, and hopefully there will be no change in that.
Thank you.
Okay, St. Paul is always out there to help people too. I'll just give a little plug while I'm scrolling down. Hold on one second. I have a lot of information. I tried to highlight that it was important. So the building department, permit applications are by mail only. We are not having people drop things off in our lobby. It got a little crowded in there, so we're asking people to just mail in their applications, and inspectors are going to be inspecting only new construction at this point. If people need an inspection, they need to hire a third-party inspector who will provide proof of inspection. A lot of people gave me a lot of information, but I'm trying to boil it down here. So I think for the planning and the zoning offices, they're looking at their meetings and their schedule, what they can do remotely. There may be some delays, but we are planning to continue business as efficiently as we can. Cemetery, our cemetery workers do meet face-to-face regularly with customers. We're trying to keep the Pine Grove Cemetery office closed and meet with them outside, on the phone, however we can do it. If we do need to meet with them in person, we're doing it with a 6-foot social distancing. Veterans agents, most of their clients are elderly and require home visits. He's continuing to work with them through email or phone calls as much as possible. And if there are emergency needs, we will handle those as they come up. The checks have been changed to all mail to reduce town hall foot traffic. If anyone has questions, again, the phone numbers are all on our website and they can contact them that way. Conservation, pretty close to planning and permitting. We're going to hold those hearings as soon as we can, recognizing that it is challenging, but we will try to keep up with all time-sensitive needs. Parks and Grounds, right now, not a huge impact because we're not doing programs. Obviously, we have programs for the after-school kids. We're looking at whether we can do anything remotely, meaning virtually. That hasn't been figured out yet. I think we are asking you about the sports fields. The school sports fields are closed. If we're recognizing groups not larger than 25, that would be most of the sporting clubs and events that go on. They are looking for direction. We have not reserved any of the fields for any of that, so we're looking for some guidance from you tonight. I think the Rec Commission and Parks and Grounds are looking for guidance from you too. I mean, we still have playgrounds, we have the tracks, we have the common, we have outdoor, trails. Everybody is free to use all those, of course, as they see fit. The library, everyone's still working. They did close. There's lots of things available online. I think they have waived turning back books right now. Of course, we never find, but they're looking at what programs they could get set up remotely and virtually to assist our residents. And assessors, we are canceling all assessor inspections right now, and it does impact final abatements. We may need to see if we can seek some legislation for some deadlines, which is something I will do through my office. Exemption applications are coming for April 1st. Again, we're going to see if we can extend that. Motor vehicle abatement, same thing. Occupancy permit inspections will be discussed with Henry, and the reval, we'll be working with the DOR on that. The accounting office, our payroll, all those don't typically have a lot to do with the outside public, but we are making sure we're redundant in our staff and keeping people safe so we can continue with all the town's financial obligations. My office, we're all working. We're trying to separate ourselves so we can continue no matter what happens here. And most of it can be done electronically. Your agenda is everything we can do electronically. As I mentioned, we're hoping no changes to trash and recycling. So far, we haven't really had anything except people asking about, can they have a parade? And I think everybody's kind of recognizing things are up in the air right now. But that's kind of in a nutshell, the highlights. I have not really received too many complaints. I think we had one person who was trying to close on his house and needed fire smoke detector inspections, and we're working on how we can either get that waived for a period of time or something. But other than that, I think the residents have been wonderful in understanding what we're up against and that we're trying our best. But we're open for business. Just email or call us, and we're happy to help.
Thank you, Jody. Any questions from the board here? Yes, Tom.
Jody, first, thanks for you and the staff and all the hard work you're doing. It's an amazing task and a great accomplishment. I'm thinking about the senior population. Thanks for bringing them up early in your update. And I'm wondering what kind of coverage do we think we have? Do we have a good sense of all of our vulnerable seniors, how many we've got a way to contact, and have we contacted them all? And what's the best way for us to understand that we've got really good information going both ways with that group?
So I think we're right on top of it, Tom. I mean, we are used to storms. We've had many since I've been here. We always contact our shut-ins and our elderly. So I think we're in good shape. If people feel that we're not, they need to contact us. But we know who our senior population is that needs assistance, and we are helping them right now. We're fully staffed at the senior center, and I don't think we're forgetting anybody. So if anybody knows of someone, please contact any of us. Me, Jennifer Claro, or any of the people I gave phone numbers. We're happy to get right on top of that.
That's
Elizabeth?
great. As we move into this, I think that is an area that I could imagine us in a future meeting saying we need to get more resource there, because to handle some aspect of testing or coordination, there's a large number of them. So we want to make sure we're connected.
Tom, it's Sue Hanley.
Sue.
So the health department's been in touch with the Allison Christopher and Annette Cerullo, and the MRC has been involved in helping the seniors. So we've also let them know that the school nurses are available to help the senior center. So there has been reaching out to them to let them know. At this point in time, the MRC has been very, they're ready to go, and they've been helping with seniors that need help with shopping and things like that. So there are a lot of people that are trying to help on this line.
Thanks.
Jody?
I would like to mention that our vans are running. We are limiting the occupancy to 4 seniors so we can keep them well spaced. We are taking them to the grocery store if they want, to their doctor's appointments, to the pharmacy, whatever they want. We're just asking if you feel ill not to call for the van. That would be handled differently, either through a call to your primary care. I mean, obviously it's an emergency 911, but we're asking if you feel ill not to ride in the COA van. But that's still running, and we're helping seniors get to where they need to go. We also have volunteers of people that will do grocery shopping and pick up things at the pharmacy, and we're sharing all this information. If they don't want to go somewhere, they want someone to pick it up and drop it off.
Great. Thank you, Jody. And thank you, Sue, for the assistance from the school nurses. I think that's a good sharing of resources and helpful for the seniors. Any other questions from the select board or any other panelists about town services right now? All right, thank you. So Jody, I think at this point then we should move into the decisions that the board needs to discuss tonight and either make those decisions or decide what information we need to come back next week to make the necessary decisions. So the first one had to do with, sorry, I'm just looking at my notes here, canceling any non-emergency or time-sensitive meetings. We had asked committees to cancel any non-essential meetings. So as a board, I think we need to discuss how long that request will be in place and at what point do we, if groups would like to meet remotely and continue their work, because we do have committees and task force that are interested in continuing to work, how we would do that and how we see that going forward. Yes, Jody, and then Andrea.
Oh, sorry, Andrea, I didn't, but let me just say this for operational. So I think we should remember that Mike Wells is assisting people doing this right now. His time is precious. So I just want you to keep that in mind. If people can do this themselves, then that's great. But if you're expecting Mike Wells to also participate, it is difficult because he has a lot of other things on his plate at this time. So I just want to mention that.
Right. So I think if boards are going to meet and they have the tools to do it remotely, if our board is comfortable giving that direction, they can do that, provided they take thorough notes and minutes that will be reported back. And if possible, as we did on our agenda, if they could publish how residents could join that meeting if they choose, if it's something that they can call into. I think that would be an appropriate way for some of the boards to continue the business they've been working on. Andrea? Yes.
So a couple of things. First of all, in terms of how long, I think it's got to be a minimal till probably through April 7th, which is when schools are closed. And also the governor has closed all restaurants, I think, until actually April 17th. So we might want to say that this goes through at least until April 17th so that we're in compliance with what the governor has said. And then the second thing, just for people who may be wanting to set up meetings on their own, if they use Zoom, Zoom has a record option, and you can actually record the whole meeting as well as any documents that might be looked at during the meeting. So that's a way for people to, at least, keep their minutes and have a record of the meeting itself. So I don't know, Mike can tell us afterwards if that we can do that on this webinar or GoToMeeting or not, but you can record your meetings.
Thank you. Mark?
Yeah, so I'd encourage us to encourage everyone to the extent that they can do their meetings remotely to continue business as usual. I think, all of the committees have an important part to play in how this town operates and how it integrates. And to the extent that, there's a facilitation that they can do to keep them going, I think we should be encouraging everybody to, it's business as usual, but just in a slightly different way.
Right.
So that would just be my 2 cents on the whole thing.
Okay. And I do think there are committees where folks already have access to Zoom and other platforms that they can pull this together without relying on the town's IT department to do this for them. Yes, Tom?
I just want to make sure I understand what we're recommending or what's on the table. So I understand that the physical meeting part, we're asking people to not pursue, but are we trying to put any restriction on virtual meetings? I would agree with Mark that the tools exist, they work pretty well, and we should let people continue to do their work if they're able. There may be other reasons people want to slow down because they're managing childcare, they've got some other kind of pressing issue, but I wouldn't want us to try to slow them down by not letting them use the technology, I guess.
Right. Yeah, I think the distinction is whether or not our 85 committees and task force will be calling Mike Wells and asking him to set this up and facilitate for them. I think we need to be clear that his time is limited in his ability to support this, but the committees are welcome to move forward and organize, conference calls and video conferencing on their own if they have that, if they can do that. And what about some of the committees and boards have public hearings? I'm imagining, this may work for a task force that has 6 people, but if we have, planning board with public hearings, will we wait 3 weeks? Yes, Jody.
So this platform we're using tonight will work because you can have someone present, and as you can call on them, have the picture, show the documents. So they can use this type of platform for their public hearings. Obviously, it's more challenging, but it is doable.
Okay, so should we leave that up to the discretion of those boards if they feel they can effectively host a public hearing? I know some are more contentious or involved than others. Leave it up to the discretion of the board chair and board to whether or not to move forward with their public hearings. Any objection to that? Yes, Andrea.
I think, yeah, I mean, I think we should, and just everybody needs to remember, and particularly with planning board, notice, deadlines, public notice in the papers, et cetera, for any public hearing. And I would expect that, those committees and the chairs can work cooperatively with everybody and with the developers to make that work, or to grant, extensions of time if need be.
Right. Okay. So Jody, tomorrow, could your office communicate that? I know a lot of committees had put their work on hold. Communicate that direction that they can proceed if they can organize the tools to do that. All right, so our next item had to do with implementing other recommendations, such as consider limiting usage of town fields or the commons, or the Rec Commission was asking for direction about their programming. And so I think we need to discuss what our recommendation will be. I think, certainly following the governor's guidelines of 25 people or less rules out a lot of the the leagues and the sports activities that the Rec Commission typically sponsors. Yes, Mark?
Yeah, so I think my only guidance there, this is somewhat dependent upon how long this lasts and when the fields will be open. But from an individual team practicing, if it's a team that's less than 5 and they don't congregate in multiple teams, whether that be Little League, whether it be the adult leagues or whatever else, if the fields are open gym, because the fields aren't in good enough shape to do so, and it's less than 25, I think it's okay to encourage people to get out and do some exercise during this time and kind of do what they need to do and try to keep life as normal as possible, but being within the guidelines of safety. So if we get to the middle of April and, there's, whether the teams are comfortable going out on their own with the reservations of the field at the appropriate time, with some distance in between those times in which they can use the field, so there's not an overcrowding over 25, maybe something we should consider.
Scott?
I'm sorry to interrupt, Elizabeth. This is
Yes.
Zach Catala from the Westford
Hi.
Board of Health. I believe the new number of guidance is 10, not 25. Just wanted to give you that.
Hi, this is Jeff.
Yes, Jeff.
We believe that to be correct too. That was updated on a conference call at 3 o'clock today.
Okay.
We're waiting for guidance to have it in writing.
Okay. Thank you for that update.
For many teams then.
Very little team, right? Well, I think this.
Half a team.
Yeah.
Right. I think especially with the number 10, that really seems to rule out any of the rec teams or leagues, because you get, even if it's 8 kids on a soccer team, you get the parents, and now we're up to 16. So I think the advice to the Rec Commission would be, if we're looking at a minimum of 3 weeks of this, right? Or, the CDC saying 8 weeks. So somewhere in that time frame, I'm not sure how the Rec League will organize and run their spring sports if we're looking at 3 to 8 weeks before we know what we can do.
Elizabeth, this is Sue Hanley. Sorry to interrupt.
Yes, Sue. Nope, please.
So I coach a girls on the run team at the middle school, and we have been given directives that we're not doing anything until after April 7th. So to me, this whole idea of how we're going to protect the public, it's so important that we have no congregation. I mean, when we think of 10 or less, that is, I get worried about the fact that we're talking about such a small number. I mean, kids are still going to the mall. It's mind-boggling to me. We are trying to prevent the spread of this virus, and the only way to do that is if people listen to what has been, suggested to us. I don't like the fact that they keep talking about recommendations. I wish they would say directives, or I think it makes it a little bit, leaves it up to us too much. And I do think that as a town, we have to be very, very, together on this, saying we've got to avoid all of it. People have to stay at home. We have to do everything we can to avoid any type of getting the virus, having it spread like wildfire in our town. And the only way to do that is for us to work together and say, none of it, less than 10, no more than 10 people, no sports can go on, kids should not be at playgrounds. Again, we have to think about the virus and how it spreads. It stays on surfaces for up to 7 days. So if you have kids playing out on a sports field and their soccer nets, etc., that's how the virus spreads. So I would recommend to everybody that we really come down hard on recommendations to our town members, or not even recommendations, directives, to say this is what can and cannot be done.
Thank you, Sue. And I just got a note from a resident that the MIAA high school sports season is on hold till April 27th. So, they're looking at 6 weeks. So I think I agree with you, Sue, that we should communicate that recommendation give that, not even a recommendation, but give that directive to the rec department. That they follow those numbers and dates, and if that means sacrificing the spring season of sports, then that's what we're going to have to do this spring to address this.
Yeah.
Any other comments? Thank you, Sue. Any other comments from the board or any of the other panelists? All right. Somewhat related to that, because it's also recreation. Yes, Jody.
I just want to be clear. So are you saying through 4/27?
I think that's reasonable. Does the rest of the board feel using that date for now for the fields and sports is reasonable? Yes, Mark.
Yeah, so I'm in complete agreement that we need to be consistent and we should be as strong and as forceful as possible. The date, to me, whether we go out a month, 6 weeks, is a little less important, because each day, each week, there's more information. So if we want to say 2 weeks until the next time we're together, or a week till the next time we're together, and we'll then make another decision. The fact is, we could say 3 months if we wanted to, right? The fact is, we don't know anymore. And I think we should allow the public and ourselves the appropriate information to make that call. So I don't know how important it is to say until April 27th right now. If we want to say till April 7th when the schools go back, for now, and that may get extended as more information comes out. I just think we need to give ourselves as much flexibility as possible with the direct.
This is Sue Hanley. I would totally agree with you. One of the reasons that the MIAA is saying April 27th is because Boston schools are closed
I lost
until April.
Sue. Did everybody else lose Sue?
No, we hear her.
No, we hear her.
So the Boston schools are closed until April 27th. And that's why I think the MIAA is not, they're saying no sports in the high school level until April 27th. Hello? But I agree, Mark, that we should definitely say April 7th.
Okay, I can't hear anyone though.
Are you unplugged? Can't hear me.
Mark, can you hear me?
Yeah, I think everybody can hear you, Sue.
We can all hear you, Sue. Yep. Elizabeth can't hear any of us.
Right, I can't hear anyone, so I'm afraid someone else is going to have to take over while I figure out what's going on here.
Tom, you're the vice chair.
Happy to do it. So I think the guidance,
I think my tech support's coming.
I think the issue on the table
Elizabeth,
is,
we can hear you.
So Jody, is there a time interval that would be particularly helpful or useful because there's decisions to be made? I think that what's on the floor now is through the 7th. Is there any reason that you can think of that we should pick a different date because of some planning concern?
Okay, I'm good now. I'm back.
Okay, Elizabeth, I think we're saying that we agree that we should say we're at least going to issue the directive for the 10 people or fewer, which is going to have all those impacts on the rec department that we've just talked about through the 7th, and then we'll reevaluate as things go.
Okay. Sounds good.
You okay with that, Jody?
Yes.
Related to that, because it's recreation related, there's been a conversation about the community garden and whether or not to open the garden this spring, because people do gather there. However, we are spread out, but there is some, shared use of water spigots. So if it's okay with the board, I would like to take a week and let the folks who have been organizing the garden to put together how they would propose running the garden this year if we were to move forward with it. And then we'll have the opportunity for our board to look at it. And I think also the Board of Health could look at it and see if they think it would be safe to open the garden and use that space this year. Yes, Mark?
I have a question, maybe for you, Elizabeth, given your background, or Sue's. So to the extent that somebody were infected, either knew or didn't know, and were in the garden, and through water or anything else that would go into the soil, is there any risk of contamination?
I don't believe there's any risk of contamination in the soil. I think it's just if you're touching the leaves, for example, if somebody's in the garden, we have to talk about the surface and the fact that, this virus can stay on surfaces for 7 days. So, I don't see anything about the soil, but I would think, again, people touching the equipment or any of the leaves in the garden, that could be an issue of spreading the virus.
So this is Joanne. Can you hear me?
Yes, we can, Joanne.
Oh, okay. Hi. So the surface thing is really talking about solid surfaces. So desktops and things like that. It's called fomites. There's nothing to say that this virus lives in the soils. Hopefully in the gardens, they're using their own equipment so that there would be sharing and touching of equipment. It's a direct spread, so it's not airborne. Somebody would have to be in very close contact. So if they're all spread out, not coughing or talking or getting anywhere near another farmer, the chance of transmission outside like that, I think that's pretty low.
Okay, and I think that was already some of the preliminary discussion had to do with, in the past we would share watering cans or, have some shared tools. Yeah. And so so we started discussing how could we limit, what can we limit? And then what we're left with, is that an acceptable, would that be acceptable? And I think we would welcome the Board of Health, to look at what that would look like and see if we could safely move forward with it. Yes, Tom?
I just I agree with the proposal of taking a week to think about it. We can talk about it next week. I just think in this environment, the burden is really to make us convinced that it can be very safe.
Right.
And so when I would look at it, I would really, want to ask questions about, can we be sure people won't share things? Can we make sure that this is really going to be a truly safe environment?
Right. Yes. Actually, Scott, I think wanted to say something, and then you can speak, Andrea.
Well, I guess the idea was that, as a gardener, I just sort of the drill, and I think most of us have got some of our own tools anyway. I think that the biggest risk is the garden opening, which of course is when, hopefully the garden is operating into September. This thing is over with in, April or May. But the garden opening is when we're going to be in the middle of this thing and the biggest congregation. So I think the challenge here is to figure how do we get the fence up, without having that's the hard part. Beyond that, I think we have the spacing to make it work.
Right. And so we'll take some time to think about, all of that. And if we think we can do that safely. Andrea, what were you going to say?
Well, I was actually going to talk about the openings that Scott took that away. But the other thing to worry about is also the spigots. Okay. And all of it, the hands on the spigots. And I don't know, if most of the time, we're wearing gloves because we're gardening. And if we make sure that everybody is wearing gloves, that might be a way to also ensure the safety of everybody.
Right. Jody, did you have something? Yes.
Yeah, just like to say if the board does decide to move forward, I think obviously town staff will do what we can to help with the fence or whatever, using our highway workers. So we're happy to assist, but I agree with all of you, it needs to be safe.
I think there is another element to this in the bigger scheme of things that has to do with food security. And I know the garden is relatively small in the scheme of things for our community, but for 150 or more families, it is a source of food. And I know folks are, thinking about food security and thinking about access to high quality, nutritious food at this time. And so I, put that into, I keep that in consideration as we make this decision.
And
I think
also,
some other folks wanted to speak on the panel. Yes.
this is Joanne. Also, along with that too, is a little bit of a sense of normalcy. I mean, this is a crazy time, and if this is something that people are used to doing in the springtime, we don't have to make this decision as just, as brought up. We can take a week and try to come up with some good guidelines. But along with being able, like you said, to have good food, we also want to be able to get people outside into the air, try to create a little bit of, what's normal in their lifetime. If the kids, can get out, it could be a good learning experience, in the garden. And I think it's something that, for all that we're taking away, this could be something that we would allow to happen. I think, we could probably figure that out.
Thanks, Joanne. Was there someone else making a comment from the Board of Health?
It was Jeff.
Yes, Jeff.
I'm happy to sit down with anybody and we can examine what best practices would be for the entire facility.
Okay. Thank you. And I think the garden organizers were hoping to get that assistance from the Board of Health. So thank you, Jeff. All right, so we will work on that and we'll bring it back in a week and see if we have a plan that we can move forward with for the garden. Any other comments or questions about usage of town fields or the common? I know, I think in general, the sentiment that I've heard from folks in town is hoping that we can still continue to use the wonderful amenities we have here in town, but just continue to implore residents to do so safely, meaning, if you go walk on the track, keep your distance, enjoy the trails we have, but keep your distance. Maybe take your kids out to kick soccer balls, but not invite the whole neighborhood to play soccer together. So I'm hoping in this time we can still enjoy the wonderful outdoors here, but that residents will respectfully do so in a way that's safe for everyone. All right, so our next item has to do with town meeting, which is supposed to be on Saturday, March 28th, and clearly we are not convening on March 28th. Our town manager has proposed that we delay until May 2nd. And again, we can revisit this decision in April if we decide we need to push it out further. Jody, do you have any comments about what we need to do or what it means to postpone town meeting, what that will do to operations?
So we have not posted the warrant, so it takes a Board of Selectmen vote. I think at this point, the legislature has given us some tools to do this with, so I don't see any detriment to continue until May 2nd. That is still before the town election scheduled for May 5th. If that changes, and I think we're going to talk about that in a minute too, but no, I don't see any downside. I won't post the meeting until 14 days prior. So if that changes, you can consider that before that date.
Thank you. Any comments from the board or from Susan Spooler, our town moderator? Are you on, Susan? Yes, Mark.
Yes, sir. Hi.
More of a question, Jody. So as we think beyond May 2nd, and just kind of contingency planning here, can you just share with us a little bit of what happens as it relates to both yours and the schools able to spend beyond the end of June, to the extent that something extends that far? Again, not something I have to worry about right now, but I am a little bit curious.
So the governor proposed legislation, a bill this week, which I did send out to you, and I believe I also put it in your packet, hopefully, So in this bill, there's lots of different things that we can do to continue spending if it passes. What I'm being told is that they're taking this very seriously. They understand towns aren't going to be able to spend after July 1st unless action is taken. So at this point, I think, you know, we can delay it. There's no reason not to, and let's just take a week at a time and see what happens and see if his bill does pass.
Susan?
Susan Schooler. Hi. Governor has put forth a bill called an act to address challenges in town governance resulting from COVID-19. This is currently in legislature, and from my latest contacts, this should be signed no later than Thursday, and this would allow us to push out town meeting as well as other town business that we need to get done. So we should know something shortly here.
I will say we can push out town meeting right now, but to push it out beyond June 30th, that is in his bill. But right now, the board has the right to push out town meeting until June 30th.
That's correct, as we work on this as a group, yes.
Yes, Tom?
Do you need a motion?
I think so. Yes.
Okay, I move that we move town meeting to May 2nd.
Second,
Do I have a second?
second.
Thank you. Any other comments or discussion? All right, all those, I think we should just do a roll call vote. That will be cleanest. Mark? Tom?
Aye.
Scott?
Aye.
Andrea?
Aye.
Aye. All right, thank you.
So May 2nd.
So our next item is to discuss the town election date and what would be involved if we find it's necessary to postpone the May town election. Do you have that information, Jody?
Oh, I'm sorry. So that has not been, I'm sorry, I'm getting distracted. People are texting me and sending me emails out even as we're on this meeting. But so that is in the governor's legislation, but that has not passed yet. So I think it's certainly something that you can think about, but you probably don't want to take a vote tonight on.
Okay. Any questions or thoughts from the board about that issue, Scott?
I guess, I mean, just logistically, we already have the ballot set now, right? We know who's running for what spots, and the one question I have is town center building debt exclusion. I guess that would be a function of town meeting. So if we defer town meeting past the 5th, there's a problem with the ballot.
So Jody, does the town center building need to go to town meeting first and then to the ballot? Is that the order?
No, that's the preferred order.
Okay.
Generally, you don't ask the ballot before you've explained what you're trying to get them to vote on. So, you know, there's a couple different things. If town meeting is delayed and you want to go forward with the election, if the town center stays on the ballot and it fails, then you call a town meeting and it passes, you can call another town election and re-vote that.
Okay.
You know, I guess what I would recommend is that's still several weeks away. I think you may be talking about meeting weekly during this period. And I would say, why don't we just stand by and see what happens with what's going on with our situation we're facing, and then you can make those decisions later.
Okay.
We have not printed the ballot. We have not printed the warrant yet. You have not voted on the ballot yet. You know, you approved the language for the town center, but you have not approved the election ballot yet. So that will still come to. So you can also, if it looks like we're not going to call a town meeting before the election, you could choose to not put that question on it and call, if it passes town meeting, call a special election. There's a lot of different varieties that we can talk about.
Okay. Mark?
Yeah, so what, do we have degrees of freedom as to when the election actually occurs, that date?
You don't yet, but my guess is it's probably coming.
Okay.
So it's in our
Yeah.
charter, right?
So let me just say this. Well, I should have said this. So, if you choose to ask to change your election before the governor proposes a bill that gets adopted, then we would need to do that through a special act. So we would ask KP Law to come up with a special act that we would file with the legislature. I've talked to John Giorgio about this. It is our kind of belief that probably that proposed legislation is coming based on the situation that we have in front of us. So again, I think it's a little premature to really make that decision. We can put it on May 24th and talk about it more in depth, but I don't know why the governor they limit us to 10 people and then not allow us to postpone elections. The only other way we could do an election, it would be through what's the word? Where you mail it in.
Absentee.
I've been a little sleep deprived, yeah. So, but I think it's a little premature. I guess I would rather maybe wait until next week and talk about it a little more if you want. I don't think there's any great urgency. The urgency was to delay the town meeting, postpone the town meeting so we can get that going. We don't have that urgency on the election right now.
Okay, I do think when we consider the election, I am concerned about the candidates' ability to campaign and for the public's, the opportunity that the public will have to get to know them, especially with a school committee race that's highly contested. I think the candidates and the public will need an opportunity to meet the candidates, hear the candidates, have candidates night, all those important events. So it is on my mind about whether or not the public will have sufficient time to get to know the candidates before making a decision. But I agree that we can wait another week or two and see what the governor does. And there may be an easier path to consider that change once the governor takes an action. All right. So moving on from the election date, any other questions or comments in general? Otherwise, I think maybe Mike can help me open it up. If any attendees have questions or comments, we could hear those. Yes, Tom?
I did have a question for our fellow Board of Health board members, and I can wait till after the public if you wish. But the question is, we want to be good teammates for them, and it would be good to know what the next phase they're planning for. So for instance, if you go to the Board of Health website for Cambridge or for King County, which is where Seattle is, you can see what boards of health are tasked with when the whole infection rates move beyond where Westford is now. So it's really a question for them. Are there target points they have looking at other communities that are further down this road than we are? And if they have any comments or any requests that they would make to us to be supportive of their work.
Thank you, Tom. This is Zach Cataldo, Chair of the Board of Health, and thank you. I really appreciate that we're working together on this. We definitely want to work with you guys working forward. One point I did want to bring up has to do with supplies, because there's been a lot of, I think, confusion about them. I think there's been this idea, might have come from the state, might have come from even our rep, Jim Arciero, that somehow we have a big hoard of, big pile of supplies. We have supplies that are for emergencies, and this sounds like an emergency, right? So I think everyone's thinking, aha, great, the Board of Health has the supplies for the emergency. The emergency that we have supplies for is if we have something that we can treat the entire town for. So for instance, if we had a flu vaccine that we are going to give out to the entire town, we have the supplies that we need and the resources that we need to give those supplies to everyone in town. In this case, this emergency, we do not have that. We do not have the ability to give everyone some kind of magical vaccination. So we are not the storehouse for N95 masks or for gloves or for hand sanitizer. I wish we were. I wish that we had a big pile of them that we could give out. So I want to make clear to you guys, the selectmen, that if the first responders in town, the firefighters, the police, the schools need these supplies, we are more than happy to help try and get them. And in fact, one of the things we just heard today from the Department of Public Health is that the state is opening up $15 million worth of funds for boards of health. And so if we feel that we need to go and try and get some of these supplies to be prepared and proactive, then I think that we should work together to find out what those are and see what we can get. So just to let you guys know, you probably already know this, things like the N95 masks are on back order everywhere. We are trying as a department to get hold as many as we can. We do have some that are supposedly on their way, but we don't have probably enough. There are other supplies that we probably can get. And so what I'd like to do is work with Jody, work with any other heads of departments, with Jeff Stevens, who is our director of health, to basically find out what each department already has. And so I've kind of directed Jeff to put together a spreadsheet of, what does the fire department already have? What does the police department have? So that we know what they have, what they need, what we have. And so the miscommunication here, I think, is that under a normal emergency where one town has a problem, we can reach out to surrounding communities and get a hold of a lot of different supplies, which would obviously be, donated to us. In this case, because every town needs them, and this was not something that was ever supposed to happen, I guess you could say, and something that the federal government never planned on, we don't have the ability to ask other towns for those supplies because the chances are they're going to need them themselves. So I guess I'd say, in short, moving forward, there's a bunch of things like commercial disinfectant, eye protection, sanitizing wipes, hand sanitizer, gowns, gloves, flex wipes, and so forth, that some of those things we can go out and try and get, and we'd like to work with you guys to get them. Now, the big question that we have is just budgetary. Should we go to FinCom with, say, $20,000 ask and, move forward on that? How would you like to do that?
So Jody, how would we handle if they do find that quantity of supplies and we need that type of money? Do we call a FinCom meeting?
Certainly, I think FinCom would be the first order of business. I think the governor's legislation that he's produced does allow for deficit spending, but obviously the Finance Committee has a reserve fund, and I think that you can meet in less than 48 hours in an emergency situation. So I would start with them. We have been collecting inventory. I know that Paul Fox gave us an inventory because the schools are closed. That opened up a lot of more supplies to us. I know Jeff was successful in finding 2,000 masks. I did check with the fire department and police department. They felt that was sufficient. We've ordered those. I know today he talked about goggles and glasses. So we are working on that. I think maybe the communication is the CDC and the State House is advising us that the method to buy these is through our local Board of Health. It's not that they think we have them stockpiled, but that's who we're supposed to go through to get them. So, but I'm happy to work with Zach, Jeff, and the Board of Health and get everything we need. And we've also, that's why we're asking the public. If you know you have a situation in your home, please let us know so that we can preserve our equipment as long as possible.
This is
Joanne. We're feeling comfortable right now, so I don't want the public to be worried about this, but we need to be smart about how we use these supplies.
Joanne?
Okay. Sorry, Jody. I just wanted to also say too, I mean, we as health officials have our supplies for those, some similar equipments that say EMS would use, but EMS has their set of suppliers because they do that. They, obviously stock all of this on their own, as does the schools. And I would expect, anybody that's dealing with the buildings. So, in terms of sanitizing and cleaning equipment. So it's not just us. So I think it might be, a coordinated effort from who's ever doing the purchasing for all these different areas in town to kind of get together and see who's using what supplier and what kinds of things that they, have access to, as opposed to, shouldering this on the health department, because that's not really our responsibility to be stocking, the town.
Jody?
We are working together. I think one of the problems is that most of these suppliers are out. I think as we know what's happening around the country, and a lot of people have stocked up on different items that has depleted what's available to the first responders. So that is, again, we don't, we'll work together. We will do the best we can and move forward together to get us what we need.
Thank you. Yes,
Elizabeth, it's Sue Hanley. Just one
Yes.
comment. Jody, has there been given any thought given to when you were saying that the calls come in, if a call comes in and it's a suspected coronavirus, has there been any thought to only having the fire go and not police, just so that we're saving equipment? So in other words, they're a backup, they're there, but not sending police and fire together, so that we don't have to use up resources like the masks and the gowns. Again, if I'm only talking about a suspected coronavirus call, if they just had fire go out on that.
We have changed our procedures. I don't really need to get into the specifics of that, but we have changed our procedures to help protect our first responders and to help limit the amount of equipment and supplies we're using. So we have made adjustments. I mean, right now, we've had maybe one call that we suspected. So this is not happening a lot right now. That may change, but right now we're just trying to get ramped up to be ready.
Tom?
Just so very important discussion around supplies. Absolutely. My point was maybe in addition to that, it would be really helpful, I think, if the Board of Health could profile a couple communities that are further down the trail than we are and help us understand what kind of activities and challenges and tracking challenges and testing challenges we might need to be getting ready for. I'm sure you are, but I don't know if that's New Rochelle or if that's somewhere in Seattle, but someplace that's seen a much higher infection rate. I think it would help, at least help me to understand what we should be thinking about and what posture the town should be in to get ready for that.
I can take that if you'd like, Elizabeth.
Yes,
This is
go
Zach.
ahead, Zach. Yep.
This is Zach Cataldo, Chairman, Board of Health again. There are a bunch of policies and directives that we're working on at the board level. I'll just go through them kind of line by line, just so you can get an idea of the things we're thinking about. We're going to be putting together a directive, a policy that limits the first responders to potential or positive cases that I believe it was Joanne just talked about, Sue just talked about, so that only either the fire or the police department, not both, respond. And it sounds like they've already worked on that themselves. We're working on developing a protocol for accepting takeout deliveries and groceries. So right now we know there's a lot of residents in town who are going to be doing DoorDash and they're going to be doing takeout. And we just like to put together a protocol for how those delivery people should deliver, or how, if you're going to pick it up, how you should pick it up. So that'll be coming out soon. We're going to be developing a protocol for the opening of town buildings and how to respond to those returning after being sick, so that we'll know how, what we're supposed to be doing to clean those buildings, and a policy on returning after you're being sick. We're going to be developing a disinfectant document. There's already some EPA documents out there, but a lot of people are asking, how should things be wiped down? How often should they be wiped down? And what to do if a disinfectant is limited? And so, can you make stuff at home? So we're going to be coming out with that as well, because these are questions that are going to be coming up more and more as the weeks go on, and people might run out of things. We're going to be talking about potentially closing some of the pools and gyms, especially at the hotels, coming up. We're going to be talking about potentially, right now, one-stop fun and places like that, and ballrooms at the McDonald's so far have closed voluntarily, but we're going to be talking about whether that will be a directive, not just voluntary, and for how long. There's already a policy at the state level to deal with nursing homes, to ensure that visitors, how visitors are to be visiting people in nursing homes. So that I don't think we have to worry about, because the state has worked on that already. There's something I'd like to ask of the schools, and maybe of you tonight, which is that we have a lot of senior high school students at home right now who could be utilized. They can drive cars, they can go get groceries and medicine for senior citizens. So we are going to be working with the senior department to, if they need help getting things moved around town by individuals, that could be done that way, which might be a better use than our MRC, which are mainly older people, and so we don't want to put them out there in risky situations more than necessary. As I talked about before, Jeff is kind of heading up the central supply list, so that we'll know what we have in town, so that all of you will know, I will know, all the police chief will know, fire department, what we have, where those supplies are, in case we need them, instead of having to make frantic phone calls at the last minute. We have told, basically just came up with the directive today that our public health staff is being shifted from kind of routine inspections to more of a hands-on deck. So we won't be doing as many just routine septic inspections and so forth, because we need to be focusing on this. And then we're going to be doing a policy on the self-serve ready-to-eat salad bars, buffets, basically closing those down until the restaurant ban is over. The same on self-seating areas, the lounge areas that you see at places like, for instance, Whole Foods, making sure that those stay closed until the restaurant ban is over. We are going to be talking about playgrounds, what to do, whether we should restrict their use or close them, because I agree, I love to have children running around and having fun outside, but playgrounds are places where kids are going to congregate and where the equipment may not be clean. So we haven't decided yet one way or the other, but that's something we're talking about. And then some of the big issues that we want to talk about going down the road, we bought ourselves a little time here because the state has closed the schools, which is great. But we want to talk about when they reopen. When they reopen, it's not going to be that there's 0 cases of coronavirus in the state. There's still going to be cases. And so we're going to still want to slow down the spread. And so we're going to be talking about if there's policies in the schools that we should be taking, and obviously we want to be working with the schools on this, whether we should be talking about lunch, the cafeteria area, that's where most of the kids are going to be in their tightest, closest quarters. Should we be talking about having lunch in the classroom? Should we be talking about having students wearing surgical masks to go to school? I know it's not something that sounds like a very American thing, but in Asian countries, well, don't shake your head there, Mark. If you look at the data from South Korea, the reason why that they are now dropping so fast on their transmission rates is because of masks. And so it is not that it's not an N95 mask that I'm talking about. It's just a simple surgical mask. It reminds kids not to touch their faces, and it also keeps kids from spreading the droplets. So if kids go back to school before the coronavirus has dropped to 0, this would be one way that we could drastically reduce spread in the school.
Mark, did you have a comment?
Oh yeah, it was just the reason I was shaking my head, Zach, was are these the same masks where everybody was told not to wear because of their very little value?
Well, so their value is that, first of all, they do remind kids who are the worst at this of not touching their face after they've touched, their phone or their desk. And so the idea here is to remind them during the day, basically, since they wouldn't be able to touch their face, they wouldn't be able to transmit it from their hand to their face. The second part of this is we think that we should have a better hand washing regimen in the schools. Right now, there's basically none. If we were to ask our kids to go to the bathroom and wash their hands, I think we all know what that would probably mean is that a large number of them wouldn't. So the question we're trying to come up with here, and we'd need to work with the schools on this, would there be something like when kids come into the classroom for the beginning of the classroom time, would there be a 60-second period where everyone takes a wipe, washes their hands, wipes down their desk, and wipes down their phone? If this was done throughout the day multiple times, that could really help reduce the spread. Another thing would be hand washing stations. We've been starting to look into, is it possible to have temporary hand washing stations in the schools? Are there enough actual sinks in the schools so that kids could, during certain times of the day, go wash their hands? Probably it should be monitored to make sure that they're actually washing them properly. So the thought here, to answer your question, Tom, which is, right now, great, the schools are closed, we're not thinking about it, but April 7th comes, or April 14th, or some other date that the schools are opened. Are we going to want to put into place directives that will keep the spread of the disease still from happening at the rate that it is now?
So Zach, I had one other question in terms of the work the Board of Health is doing, and that had to do with communication. And just as we go through the next few weeks, what we expect. Has your board discussed, either certain thresholds for certain communications that will go out, or regular communication at regular intervals, something so that the public knows that they're getting accurate information from their local Board of Health? Do you have a plan for communication?
Yep. So we're going to be meeting on a regular basis, probably on a weekly basis like you guys are. We're going to be, if the public would like to know and join us on our virtual meeting, we're meeting March 24th at 5 p.m. So that'll be following the next week's Department of Public Health meeting. And then we're going to be putting out as much information as we can, not only through listserv and the website. Everyone should go to our Board of Health website where we have up-to-date information. But we will be putting as much information also as we can out on some of the Facebook sites, because I think that right now, more than ever, people are on social media and that's how they're getting information. And so we want to make sure that they're getting correct information. So if anyone watching tonight needs the latest information, they should go to the Board of Health website. There's lots of great links there to the latest information.
Great. Thank you, Zach. Any other comments from other members of the Board of Health, or any questions from the Select Board to the Board of Health?
This is Sue Hanley.
Yes, Sue.
I just need to stress the seriousness of this virus. I'm not about scaring people. And of course, I'm very concerned about the mental health of our the anxiety level and everything like that. But I think we have to be very aware of how contagious this is. And I shared a letter from 50 doctors from Brookline today that had excellent information about how quickly it spreads from person to person. And although children are at very low risk for getting serious complications from it, they are at high risk for spreading it, because by nature of children, they touch their face. They're not as good as hand washing as we are as adults. So I am really hoping that we focus right now on shutting down everything that we can until, so that we can truly lower the curve, so we can make sure that we don't have a spike. We're talking all this, we're having lots of great information right now, but as a medical person, I get lots and lots of emails and texts from other nurses. I just got a text from a nurse, she's a nurse practitioner, and she knows a 58-year-old who's in critical condition at UMass Medical right now. So we cannot think that this is an elderly, we can't. And so I'm just asking everybody to make sure that we are truly stressing to families that you need to stay home. Yes, go get fresh air, go for walks, go for a run. I was at EBC today. I saw people. I'm not saying you can't do that, but adhere to what is being asked. And I think we forget when we're talking about, how the virus spreads. I mean, I've been very cognizant of, I'm going to go to the grocery store, but from now on, when I do, and I'm not going to go often, I'm going to have a pair of gloves with me so that when I check out and I do the dial, I put in my debit card, I have a glove on, because you can imagine how many germs are on the debit card readers. So again, I'm asking people to really think about how this virus is going to spread. And if everybody could play a game with, what can I do to make sure that I don't infect anybody else? That is what we all should be focusing on right now. And, I don't even want to think about when the schools reopen. It's scary to me as a person working in the school system that we're off for this period of time. But right now, we have to avoid what's been going on in other parts of the world. And I just pray that we can do that here in Westford by making necessary changes right now.
Thank you, Sue. And I think any communication to that, with that message that our Board of Health can be sending out, I think will be extremely helpful right now. And I think it comes with a lot of credibility when it comes from the Board of Health. So I think I would support whatever you can do to, expand on that message, not just the, social distancing, but if you can help communicate it to the public, ways to make it real and very practical suggestions of how to limit, their exposure and the possibility of each of us leaving germs behind when we go to Market Basket or other places like that. I would welcome that and appreciate that help from the Board of Health.
Will do. Thank you.
Thank you. Any other questions or comments? Otherwise, I'd like to open it up. I think we're going to try getting questions. 1 second, Jody. Let me just give the public instructions, and then I'll come back to a comment from you. So if you are watching online with the GoToWebinar program, there is a place for questions, and you can type questions in. So if anyone watching has a question, I would appreciate if you type it in that box, and either I will see it or Mike Wells is helping me out with managing the meeting. He can read those questions out loud as well. And then we can either attempt to answer those questions tonight or get those answers in the next day or two. So go ahead and type in your questions if you have those. And in the meantime, Jody, I think you had a question or comment.
I just wanted to mention that one of the other things I was asking you to do tonight, I think the last thing, is that I am asking the Board of Selectmen if they will consider declaring a local state of emergency. It is something that our town has done, I believe, 3 times since I've been here due to severe storms. It's really just to let our residents know how seriously you're taking this, and it may allow us to apply for some grants, FEMA and MEMA reimbursements, things like that. So many towns have done it, and I would encourage you to do so, just to educate the public a little more on how serious this is.
Yes, thank you for reminding me about that point. I agree completely, and I think it's an appropriate action for the board to take. Any questions, or would anyone like to make a motion?
Make that motion.
So moved.
Second.
So moved.
Thank you. So I'll do any further discussion before we vote. So I'll do a roll call vote again. Mark? Tom?
Aye.
Andrea?
Yes.
Scott?
Yes.
Yes.
Thank you.
Thank you. All right, so at this point, we're going to attempt to get any public questions. Mike, have you seen any?
Elizabeth, no, I don't see any questions at the moment.
Okay. All right, then. I don't know if we're just, if everyone's questions have been answered. Yes, Tom?
Just acknowledging that this technology is probably new to folks. And so if they're not quite sure how to send in a question, could you just repeat where you'd like them to email questions? Because we'll be getting back together next week and we'd be happy to dig in on them, I know.
Certainly. Jody, which email address should we give out for the town manager's office?
Yeah.
Good, right?
I would have them email S Gray, S is in Samantha, Gray @westfordma.gov. They can also email me, but I would prefer them to go through, or TMAA, which is like town manager, admin assistant, TMAA @westfordma.gov. That's the best way she will help put these together for the board and for myself.
Excellent. Yes, Scott?
So just to clarify, you said Samantha Ray. Is it RAE or RAY for those who are not sure?
Right.
Gray.
S for her first name, Gray, GRAY, @westfordma.gov. It is on the town manager's page. I just would appreciate people going through her, because I am being inundated and trying to carefully balance all the emails I'm getting. So if they can go through her, I will definitely get them.
Great, thank you. And certainly you could reach out to any member of the select board. We will do our best to answer your question or add that to the list of topics to discuss next week. All right, well, I think,
Elizabeth,
yes,
one more comment, Sue Hanley. Listen, I also, as one of the school nurses, Joan Mitchell is our head nurse, and we have all been in communication with Gail Johnson and Jeff Stevens at the health department about ways that we could help out, maybe by even answering phones. And we're all going to go to our schools tomorrow and look at supplies and what we might have available that we could help with the supply issue. Some of us have things at our schools that Sandy Collins had supplied to us for the H1N1 crisis all those years ago. And so we are all going to do that. And I just want to stress for the town to know that there are a lot of resources and people that are willing to help and want to help. This is a community-wide effort to keep us all safe. And I am grateful that we can work with the Board of Selectmen and the school system to really help the residents in this town.
thank you, Sue. Yes, Andrea?
Hey, Sue, so when you do that, it might be helpful if you also check in with the business office at the school, Ingrid and Courtney and Carrie. I know that they're putting together plans and procedures as well. I know we have food insecure students that we need to make sure are taken care of. So I think any help that you can give there would be appreciated.
Thanks, Andrea. Yeah, as nurses, we're all reaching out to the different families that we work with. We've all been talking about that, reaching out to families that we know that have students with certain medical or mental health issues. So that is on our agenda for the nurses in the system as well.
Great.
Thank you.
Elizabeth, this is Susan Spooler. Quick question.
Yes, yes, go.
What does it mean that we're under a state of, the town is under a state of emergency? Does that mean we have curfews or anything like that, or just try to stay away from everybody?
No, so Jody was saying that it helps to convey to the community how serious the situation is. So it assists with our communication, and it may also assist down the road if we need additional resources to, depending on what happens here. Sometimes having the state of emergency can help with that. Anything else, Jody, in terms of why we, add the state of emergency, even though the governor has already done it?
No.
We have a question which asks us about that, actually.
Okay, go ahead, Mike. Can you read that?
So the question is from Valerie Young. It says, does the state of emergency affect any bills or payments due?
No. We are paying our bills on time.
So we
anybody
still
has
need residents to pay their bills.
Yeah,
I think,
We
yeah.
need everyone to pay their bills, even though there's a state of emergency.
Yes, at this point, yes. Nothing has changed with that.
Thank you. Were there any other questions, Mike?
No, that's the only one we have.
Okay. So I think with that, we will adjourn, and we have a meeting scheduled for next week, March 24th, which will be done with video conference. And if anyone has comments about how this process worked, either from the board members or the public, certainly send those questions along, and we can do our best to improve before next week. Yes, Scott, go ahead.
Just one question. It's tradition that we open our meetings with a pledge. So
Yes.
is there a flag for next Tuesday night? Someone's camera, because I hate to break that kind of tradition over this.
We can certainly work on that. Yes. Thank you. Mark?
Yeah, so I just wanted to say thank you, Jody, first of all, to you and all of the department heads and the department staff for what's going on right now. I know this isn't in a typical job description, and as always, all of the departments and the staff are working extremely well together. So thank you to all of you. I also wanted to thank the Board of Health. The pressure has to be immense, and all of the resources that you need and the hours that you're working is certainly greatly appreciated. And I hope you are reaching out to any of us or anybody else that you need in order to give you what you need, whether that's financial resources, physical hours, whatever it is. But so I just wanted to say that.
Thank you, Mark.
Thanks,
Andrea,
Mark.
did you have a comment?
No, I'm good.
Okay.
Elizabeth,
I'm
this is Zach from the Board of Health. Thank you,
Yes,
Mark,
Zach.
and thank you to the Board of Selectmen. I really do appreciate it. I just wanted to let everyone know that according to our staff that's been out there working with businesses in the town and residents, that everyone's been working really well together. And I just want to thank the whole town that this is unprecedented in our American history. So thank you for everyone working together. We're going to need your support in the weeks ahead. So our staff has been working tirelessly, and I really do thank them for that. And if anyone needs to reach the Board of Health, our phone number is 978-692-5509, or you can go to the westfordma.gov website and go to the Board of Health tab to get all the information you need. Thank you.
Thank you, Zach.
Could I add in real quickly? If you don't get through, leave a message. You will be called back.
Great. Thanks, Jeff. Jody?
One more thing, the town manager's newsletter hopefully will be going out tomorrow. I wanted to wait for every action you took tonight. So I would encourage people to subscribe to that, because there will be information from all the departments, senior center, a lot of information to look at, Board of Health and everything. And the other thing I'd just like to say is I went out for a walk yesterday through Mark's neighborhood, and I saw a lot of kids out with fishing poles and dogs that were all muddy, and it was great to see. There was a lot of people out by themselves with their parents having a good time. So,
Andrea?
I remember what I wanted to say. One more thank you. Thank you to Westford Cat for streaming this tonight and making this all possible and enabling all of our residents to be able to view this and watch us.
Yes, thank you very much. All right, anyone else? Any last comments? Tom?
I want to thank Mike Wells and the WCAT team for pulling this together. This actually all came up seamlessly for the Board of Health meeting that was yesterday. So nothing happens without a lot of people working really hard to do it from home over a weekend. So much appreciated.
Definitely. Thank you. Any other comments? All right. I thought you were going to have a motion to adjourn, Mark.
Motion to adjourn.
Thank you.
Second.
All those in favor?
Aye.
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 Thank you. Good night, everyone.
Thanks,
Good
Elizabeth.
night.
Everybody. Good night.
Good night.